Welcome to our annual joint IUW-ICHS Legislative Update session. My name is Maggie Snyder and I am Public Policy Manager at Indiana Association of United Ways. I also help staff the Indiana Coalition for Human Services. Today I am joined by David Sklar, who is on the board of the Indiana Coalition for Human Services and also serves as our Government Affairs Committee Chair. I'm also joined by Mindy Goodpaster, who is also an ICHS board member and president of the Children's Coalition of Indiana. Since it's still pretty early in the session and there were more than 1,200 bills filed, please understand that this is a quick overview. If you type your question about a specific bill in the chat box, we will either answer the question during this session or as a follow-up email to you. David will start us off with general information about this long session.
Thanks, Maggie. So just a reminder for everybody, the 2017 session of the General Assembly is a long session where the key task for legislators to shape the state's biennial budget. That budget is usually about $32 billion. Legislators will make tough funding decisions on the state government services, including education, infrastructure, and public safety. Just to continue to remind folks, the House and Senate Republicans comprise so-called supermajorities, where Democrats are far outnumbered. In the House, the ratio is 70-30, and in the Senate is 41-9. So basically, Democrats do not have to be present for business to be conducted at the General Assembly. Throughout the session, if you review vote counts on individual bills, most of the vote counts will include fairly bipartisan support, even often unanimous approval. However, you'll certainly see bills where the votes are divided along party lines and where some other characteristic or philosophy may affect the view. For example, issues and splits related to urban versus rural districts, or libertarian or Tea Party influences, certainly religious influences, and how things are affected by issues like property tax caps and their effect on local governments.
So Governor Holcomb announced his priorities through his State of the State address, and you can see his 5 priorities here. Top items include infrastructure, education and jobs, and attacking the drug epidemic. Since this is his first session in the governor's office, it will be interesting to see how his priorities shape out. All 4 caucuses and the governor have indicated that certain education and infrastructure issues would be the most important issues of this session. Expanding state-funded pre-K and a focus on education and training for workforce demand are also important topics of this session. The hot issues are usually the bills covered by the media. Right before the legislative session started, your local news media blew up with coverage about pre-K expansion and I-STEP replacement, and both continue to be hot issues. There are also a number of bills around tax issues, children's issues, certain programs we support, and more.
So just a reminder for those of you who have worked with the Coalition for Human Services before, for the last few years, ICHS has grouped our priorities in 5 areas, which you can see in bold. We want to take this opportunity to celebrate bills that are making some progress in these areas. In the Healthy Hoosiers category, we want to celebrate the increased attention to mental health and substance abuse issues, definitely a hot topic this year. In the Working Hoosiers area, we're very pleased to see multiple bills around SNAP access getting committee hearings, including around access for drug felons and asset limits. In the workforce, Ready Graduates, pre-K and after-school programming is getting attention, and legislators are taking a deeper look at matching some of the workforce development programs to current job demand in the state. And in the Thriving Communities area, we're pleased to see some good government bills and attention to healthy food access and bias crimes. On the following slides, we'll review bills that are still alive, which is many because it's still early, and focus on bills that we expect to see move through the process. We are listing the bill numbers, so you may link directly to the bill from the slides and notes. Please note that there were nearly 1,300 bills introduced, and many will not make it beyond the halfway mark in February. We'll go through these bills rather quickly, so if you have a question about a specific bill, please type it in the chat box. If we don't answer your question, we will get back to you, we promise. The first bill that I want to highlight before I turn it over to Maggie is Senate Bill 245. ICHS has taken on this bill as its top priority, one of its top priorities for the session. And Senate Bill 245 is dealing with payday lending. It would expand payday lending products so that payday lenders could offer longer-term, small-dollar installment loans. And we are opposing this legislation because of very, very high interest rates associated with these products, and because we know these loans are very easy to trap working families in a cycle of debt. And so ICHS has actually hired a lobbyist, or lobbying firm this session to help us confront Senate Bill 245. I'm going to turn it over to Maggie.
Thank you, David. In ICHS top priorities, healthcare coverage and closing the gap. We're paying close attention to changes at the federal level, and we'll do our best to keep our networks informed. At the state level, we're seeing more attention on healthcare provider capacity and telemedicine. There are a number of bills in the mental health and addiction space in response to the heroin and opioid abuse issues. There are many bills that aim to increase reporting requirements, both on the number of providers programs in the state and also on the need and availability of services. There are a number of bills that would pilot mental health programs in schools. A number of our members have been advocating for Senate Bill 59, which would help to streamline the process for mental health providers from other states to gain licensure in Indiana. And you can see the list of mental health licenses that are listed there with this bill. And we're happy to say that this bill passed out of committee last week, and we expect to see it continue moving.
Our advocates for seniors and people with disabilities are happy about the attention that our Adult Protective Services system has received over the last year. A couple of in-depth news articles have drawn some attention to that program. There is some renewed attention this year to work to increase caseworkers and to include a social work approach in addition to the prosecutorial approach to EPS work that's currently happening. Helping working Hoosiers and those who want to work to support themselves has always been a primary focus of ICHS. In 2017, we're happy to see two bills that could help increase access to SNAP benefits. Senate Bill 9 would allow ex-drug offenders to receive SNAP benefits. Currently, Indiana is one of only a handful of states that does not allow drug felons to access the SNAP program. Senate Bill 154 would remove the asset test for SNAP benefits so families wouldn't be penalized for having assets and savings when they fall on hard times. We believe that both of these bills are expected to get votes in, both of these bills received a vote and passed out of committee last week and will be on the floor as early as tomorrow, we suspect, and we believe that they will be successful in the Senate.
While IAUW and ICHS typically don't focus on bills around testing, teacher pay, or school performance as high priorities, we recognize that there are many bills in this space this session. You may have noticed media attention around ISTEP and possible replacement tests. We suspect that this conversation will continue beyond session. A big priority for Children's Coalition, IAUW, and ICHS is the expansion of state-funded pre-K. The two bills that will likely move this session are Senate Bill 276 and House Bill 1004. Advocates are hopeful that pre-K will receive $20 to $50 million in the state budget. There is also growing attention to out-of-school time programs and school safety. There are also a number of bills related to children with a special focus on child placement, sexual abuse, child pornography, suicide prevention, and crimes involving the internet. Generally speaking, there is an effort to ensure that children that are the subject of human trafficking are still treated as children and that the crimes they commit while being trafficked are not counted against them. Regarding suicide prevention, an issue that has been taken on by the Commission on Improving the Status of Children, Senate Bill 506 is looking to do several things. One, to increase training in prevention and intervention programs for teachers and other school staff who have contact with children, requiring school policies dealing with prevention, intervention, and postvention, creating a suicide prevention coordinator position at the state level within the Division of Mental Health and Addiction, and requiring training for licensed professionals, including medical and mental health and behavioral health professionals within the state. If you have any questions on other children's issues, please feel free to ask at the end of this session.
funding bill, House Bill 1002. Initial analysis shows that the gas tax increases in the bill will impact lower and middle-income Hoosiers more, so it will be a bit of a regressive tax, and a lot of discussion taking place around that bill. Many of our members may be partners involved with Healthy Food Access Coalition. There are 3 live bills that are aiming to increase healthy food access through a grant and loan program this session. You may also recall that this past summer there was a study committee focused on redistricting. Many good government bills have come from that, and it seems that redistricting conversations may be becoming more serious this session. We aren't sure how far these bills will move, but we wanted to make sure to highlight them. Other issues that have picked up attention in the media that we've not been following as a coalition, but would suggest keeping your eye on include bills around guns, Sunday alcohol sales, and cigarette tax increase.
We want to give a quick overview of key human services items in the budget. Many items like food banks, 211, CCDF, and the Healthy Families Program were able to maintain their level of funding. Adult Protective Services received an increase, and we know that a good amount of increase will be used on software and data collection enhancements. Nurse Family Partnership received a new funding as a special line item in the budget, and we are hopeful that funding for the pre-K pilot will continue to increase as the budget goes through the process. This document will continue to be updated throughout the session.
Now we want to fly through a few slides about how you can get involved. First, we want to remind you that you, as a nonprofit, can lobby and educate your legislators. Yes, there are rules about lobbying, which is spending your organizational resources to lobby your legislators or to ask your constituents to ask your legislators for a specific bill or policy change. Most of what we do in the nonprofit arena is education and awareness. It is advocacy. We are simply telling our stories of our organizational mission, what certain policies or investments mean for our clients or organizations or communities, and it is absolutely critical to have you as a volunteer or your board members and volunteers tell that story. We remind our friends how to get started in advocacy. If you are nervous or new to advocacy, remember that all of us were new to it at one time. There are lots of resources to help, and here are a few ideas to get you started. And here are some other things you can do now. Communicating with your legislators is a critical part of the process. Most legislators listen to constituents and sincerely care about their experiences. Attend the third house or meet your legislator meetings that are going on across the state. We post an updated calendar every week, and you can see it here. And it is updated in real time, and you can also print it. So you can see where a third house session might be happening in your area. Sorry about that. Okay. And now I will pass it over to David.
So just to wrap up, one last thing that we'd like to talk a little bit about is that we know many organizations offer a day at the State House or lobby days. Here are a few of our partners. If you are affiliated with one of these organizations, definitely consider making the trip to Indy and joining us. Maggie has recorded a short 6-minute presentation to help you prepare for your State House visit in the event that it's completely new to you or you need a refresher. And please let us know if you are planning your own day at the State House or lobby day so that we can make sure to get that information out to others. We know that there are many ways that we can work together. We have to face it, the human services community does not have deep pockets to provide the number of scale of lobbyists that the business community has. We have to work together. We have to advocate together and advocate on behalf of our clients and communities. And when we do that together, we are more effective. So at this point, we will close down the recorded session of the webinar and be happy to take any questions that you have about specific pieces of legislation. And then the final little piece here is there are listed here a number of websites that we may have referenced so that you can go back and look at those as well.
Thank you for viewing the webinar recording.